Hello there, and thank you so much for tuning in to Y254 TV. Why in the Morning is the show. Right now we want to talk about politics, and actually there's an argument going on here. What is a virus? How does it exist? Maybe you'll get to know as we continue with this conversation. Join the conversation by sending us your comments or questions to all our social media platforms. Y254 channel on Facebook and Instagram, at Y254 channel on Twitter. Send us your comments or reactions, especially when we are expecting the head of state to be reopening the economy this very day. What do you expect from the speech? What do you expect from the directives that will be given? There is cessation of movement in Nairobi and Mombasa. Will they continue? There's curfew. How does it impact you? Do you want it to continue, or you want things to remain as they are? I'm speaking to Beatrice Cairo. She's a health economist, and Christine Kendi, political analyst, join the conversation. My name is Dereva Hilary. Good morning. Ladies, how are you?
You're good.
Hi.
It's a pleasure to have you here.
A pleasure to be here too.
You know, it has been a trend. Beatrice, I will have you here after maybe a week or two. Glad you're back. And now we're speaking, the head of state will be addressing the nation later in the day, maybe from 11 or State House. However, we should expect he will address the nation, and we have so many expectations from the speech. What you'll be telling the nation: we want the cessation of movement to end, we want the curfew to end. But if the numbers keep on spiking like it has been seen, are our counties ready to handle in case of a large surge? Beatrice.
I think counties are not yet ready, though they're gearing up towards that. Now that we are all locked down, all of us. Nobody's flying out, all in. Okay, and only Baba we had that he flew out. But for normal average Kenyans, there is no going to outside countries. So I think now counties are feeling the effect that they really need to style up. But the healthcare sector is still deplorable. It still has a long way to go, because a place like Siaya County, they only had 5 ICU beds. So you can imagine if the beds, if there is a high spike of this corona, and you need more people to be in ICU. Though the treatment and management of COVID varies, there are some medics of the opinion that ICU is not really necessary. So most likely the people who go to ICU are those with other underlying complications. But generally, mechanical ventilation in the treatment of COVID is not one of the regimen that is actually being used. But be as it may, we have Kenyans with other underlying ailments, because you may be having chronic illness like diabetes or hypertension or what is it called, cancer kinds of patients. All these people have been hindered one way or another in accessing treatment. So because these chronic kind of patients, you can imagine where have they been accessing treatment and care. Some people are scheduled to have surgical operations, maybe in India or abroad. Now they are confined in this country since March, you can imagine. So you can imagine if it was an urgent operation, so how aggressive is the condition that has made this patient be. So what will happen is that now counties have to style up. We have to now trust our local medics and healthcare workers. If we've trained them badly in our institutions, that is what we are gonna get. If they are half-baked, that is what you're going to get. I think this is the time everything is now being laid bare and naked. It's exposing every sector, from education sector, healthcare sector, governance sector, church sector. Everything is, this COVID has really exposed so many institutions. So if you produced half-baked doctors, if you produced half-baked nurses, if you produced half-baked pharmacists, now we are now facing the music. So no running away at you're going to go to UK for further treatment. So if you've been eating money to, what is it called, to be to set up institutions, now the rubber is meeting the road, literally. So you'll have to now be answerable to the populace. How comes there are no supporting machines, right? How comes there are no well-established departments within the healthcare institutions? So did you even stock up for drugs? Or are you still waiting to import last minute? No, it's very, very crucial. It shows even the preparedness, because this is kind of a disaster. So disaster preparedness, how well cushioned were prepared for such disasters, right? So we really need to, I think this, I am glad COVID happened. I cannot regret that this situation did not happen. I am glad it happened. Why? Because it's exposing the dirt that has been there from all the way, not only in government based on corruption, but also in our institutions, the learning institutions, the higher learning institutions, all the way to the hospital setup, the business setup. Everybody is getting exposed. So I think now the conversations we should be heading forward is to stop the blame game, and we start now sitting back and asking ourselves, tunaweza jitegemea, can we now depend on ourselves? Now we put strategies in place on where we can depend on ourselves. If today, for example, I hear like the EU is now opening, but they have said Kenyans cannot go to the EU because they feel, quote unquote, we did not handle maybe COVID properly, or places like Tanzania, they're being barred from accessing countries in the EU. So that tells you most of the things lazima tujitegemee. We have to style up our institutions. We have to style up our healthcare sector. We have to style up. Otherwise, if we don't do that, I believe now the dispensations that we are entering in, we are going to experience more pandemics. I guarantee you. I always tell people, I'm not a prophet, but after this pandemic, there'll be another pandemic. Because global warming, things are just cropping up right, left, and center. So it is us to now sit down and ask ourselves, are we well prepared intellectually? Because preparedness is not just having equipment, but can those people operate those equipment? We were having a discussion whereby it's true right now counties are running to set up ICU. Muranga was setting up ICU departments. But then the question is, do you have ICU nurses trained? It's okay, it's good to have a building and have equipment, but are the doctors trained to treat people in ICU? Do we have enough ICU nurses? Do we have enough clinical pharmacists to deal with in the ICU? We have to look at that capacity, because it's one thing to have roads, but will people be using the roads to dry their maize, or is it because there are cars that are going to use the roads? So we really need to look at it holistically, not just to dump ICU bed in the hospital facilities, or just create a building and there are beds there, but do we have the right infrastructure? And infrastructure is not only equipment, but also the right personnel. And now even the institutions will now be not cushioned, but they will have to be very ready in even now engaging more training of such kind of personnel, because right now, next time, we may actually be having our own healthcare personnel actually doing the treatment that people are actually soliciting outside the country. So it's also upon the institution now to style up and now fully equip our healthcare workers, so that we can fully trust. Because I always say every time,
actually, I would like to hear Kendi's comments. I think you have so many ideas on this. We will get there. Now, Kendi, tell me, do you think the counties are ready to handle, because according to the Council of Governors, only a few counties have gotten to the target of the 100 beds as directed by the president. That is, Mombasa is leading with around 400. Do you think the counties are now ready to handle COVID-19 in case the cessation of movement from Nairobi to Mashinani, considering Nairobi has the highest numbers?
I don't think counties are ready, but I also think that you're going through this COVID thing from reverse. we are going through, we are going about it from behind. We are first looking at, do counties have ICU beds? Do counties have beds for admitting us? Do we have isolation units? But you see, what you're looking at is the worst case scenario, that if we all get sick, can our country take care of us? The first thing you're supposed to think about is our country is not prepared. No country was prepared for COVID. So the first thing you're supposed to look at, it's not whether the counties are prepared, is what can we do to make sure that we don't overwhelm the resources that we have.
Just a few days after the Minister of Health said people could be treated from home,
Yeah.
and now we have issues of the 300 beds. How many people will be treated from the health facilities? How many people will be treated from home? But the question will still stand. If anything, can the counties, including even Nairobi itself, can the counties match the numbers that will have spiked at the time?
No. Not just the counties. KNH, Mbagathi, Kenyatta Memorial. It's Kenyatta Memorial Hospital. None of these hospitals can manage COVID if the numbers go higher than what we have right now. You have to know that right now the ICU units that we have already have their maximum capacity. Not that before COVID we had enough ICU beds. Remember, now people have not even been going to hospitals. That I have an underlying condition, I don't go to hospital because I'm afraid if I go there, I might get COVID from there.
True.
So we are as Kenyans, by the way, let us first stop looking at whether the counties are prepared. Let us do our role in first making sure that we don't overwhelm what we already have. What can we do to make sure that we don't get the numbers higher? True. We as individuals, let's stop looking at counties. Let's stop looking at the government. Let's stop looking at Kenya. Is Kenya prepared? No. Is the world prepared for COVID? No. Is anyone prepared for COVID? No. So what can we do to make sure that the numbers don't go above the 300 that we have? Again, I think we needed COVID in Kenya. I am saying this from a good place, as a patriotic Kenyan, but we needed COVID in this country for us to wake up, for us to start having the uncomfortable conversations that we're having right now. Our healthcare system has been going down, and let us, in the issue of us having qualified personnel, yes, we have qualified personnel. Remember, these people who go to India for treatment, our MPs who go to UK for treatment, they go to public hospitals. And where are they diagnosed before they go to India? Remember, they don't just wake up and decide, naenda India, nikatibiwe huko. You first have to be diagnosed. Who diagnoses them?
Kenyan doctors.
It's the Kenyan doctors who diagnose them. So if we equipped the Kenyan doctors with the facilities that are in India for treatment of cancers and everything else, these doctors can handle all these things. So as you're talking about COVID, let us not be short-sighted and talk about COVID alone. Counties like Moranga started, they were building something. Machakos converted a stadium into a COVID isolation center, which is very temporary because you're not looking at it. It's not like COVID ndio imeleta hizi shida. We already had these problems before COVID. So these temporary measures that the counties are taking, if we harakisha the counties right now, what they're going to do is my county is going to go take the stadium, put a tent on it, buy beds and put beds in that stadiums. What happens after the COVID is over? They take back the beds, pengine wauze, wapeleke places zingine, we go back to the same healthcare system that we had. So we are supposed to push the counties to have more permanent solutions, and not just for COVID, but for everything else. When you need dialysis, I don't have to come to Nairobi for dialysis.
True.
When I need a surgery, there are counties where even what is it called, cesarean, they can't perform cesarean in district hospitals. You have to be referred to another hospital. So these are the conversations that we need to have. Manufacturing. Can you believe that before COVID we used to import? Hizi mask ambazo unanunua huko nje kwa hawkers, those are things that we used to import. Right now hakukuwa na imports zinakuja, so we were pushed to a corner where we now had to think outside the box and start producing our own PPEs. We had cotton industry. What happened to it? It died, a natural death. So these are the conversations that we're now supposed to start having. Manufacturing, we need to be independent as a country. we need to be in a place where, because COVID is not going anywhere, that's the sad reality. And countries will not comfortably export stuff to other countries because every country is hoarding for its citizens. So when it comes to things like masks, see, soon tutaanza kupata masks kama tuna import. So we have to think about that. The beds, our Juakali people, by the way, are very creative. We can have them do these things. There's a course in KMTC for, what is it called? I'm forgetting the engineering course in KMTC.
Biomedical engineering.
Yeah, biomedical engineering.
University of Nairobi, actually.
Yes, we have people who have learned these things, but we have not been utilizing them because we have been importing everything. This country that only exports flowers. Everything else, including needles. The only thing we export is flowers. That's why it was so easy to give flowers to other countries, because now we are not exporting flowers anymore. Coffee is going down, tea is going down. So right now we have to think about our food security, about our health security, about our manufacturing, which was all in the big four. Yeah. And we had all forgotten about the big four until COVID came and told us, you remember that housing you're talking about? The housing, that is what we need right now. Guys are being chased by landlords. But imagine if we had a national government housing system. It means that right now I wouldn't be worrying about rent.
You make the president smile if he's watching. I mean, his agenda was okay,
no,
but the critics were against it. Yeah.
But it was overtaken by politics
and corruption.
And corruption, of
course. Brings me to the point of the high dependency where Kenya has been. Now, Beatrice, do you think COVID-19, like both of you have alluded, that it has opened our eyes, it has made us to be naked, as now we can see all the data or the spots? Do you think we are now at the ICU, or what happens to us from the high dependency? Now we are manufacturing our own PPEs, masks and every other thing, but also there are sectors that have stalled. Where do you think we are as a nation?
For me, I think we are heading towards an economic crisis. Trust me, the way we are heading, because we never cushioned ourselves from the word go. We're ill prepared. And the other thing is, it's true we'll introduce manufacturing in the country, but where is the excellence? There's a reason why people still prefer, even right now, the masks that are imported than the ones that are made local. Why? The quality of what is being manufactured. You know, we need, first of all, we need, and I'll still insist again, from our institutions, we need to instill excellence. We have to start from that point. There's a reason why you've said that most of the MPs, by the time they go to India, they are diagnosed by doctors. But there have been a lot of misdiagnoses. Why? Because most of these doctors have not been given study leave to go and study these cancers in extensive, right? So most of the doctors, you realize, even the MP Ken Okoth at one point felt he was misdiagnosed. Only when he went outside is when it was able to get proper diagnosis. The same thing with Bob Collymore. So what we are saying is, it's not that our doctors are not intelligent, or our nurses or our pharmacists are not intelligent enough. The only thing is exposure. So where I will still insist again, right now, the economy is bado hatujafeel, it's going to go deeper downwards, actually, unless she's saying, unless we have critical conversation amongst ourselves, and the government sees the gravity of the situation, how grave the situation is. I am telling you, it is not going to be business as usual. And before people come back to their, come back to I don't say come back to their senses, or come back to that norm that was there before COVID, it will take quite some time. In another station I was saying about an economic recession. Not only in Kenya, but in other countries, they're feeling there's gonna be an economic recession where the whole world will actually feel it. So we need to stop playing around and saying we are okay, we are good, tumeanza to manufacturing here, there. No. I don't think that is going to really work. So what we need to do, I can see the president is getting a lot of donations from World Bank, from IMF, from WHO. I think we really need to utilize these resources properly. Let's utilize them very, very well. Otherwise, what I feel is that we'll get all this funding, but when all is said and done, we'll have nothing to show of it. You see, there's nothing to show of it. Number two, we are doing a lot of viraka things, you know, viraka. Me, I hate the viraka kind of doing of stuff, because uteka kiraka leo na kesho itararuka, and we have very short memory in terms of our leaders. Akiaka hiyo kiraka and now everybody is okay. No, it's not, people will not be okay. So I think we need to start from the grassroots. And what is the grassroots? Our institutions. The president, is true, he had a very good agenda, very good manifesto, even when they were campaigning in 2013 and even 2017. I was telling Hillary another time, if they had implemented the laptop project, those kids will be now at home enjoying e-learning comfortably, right?
The kids are now in class 8. Huh?
They're in class 8, yeah. They'll be really enjoying e-learning, and even in our high schools right now, yeah. So I usually say they had very good manifesto, they had very good development plan for the country, but not the problem. Na walisema kusema na kutenda, but walisema tu, there is no kutenda. So I think right now, let's go to the grassroots, and a country is as strong as its institutions. So whoever is corrupt, wacha arudishe pesa ya umma, maybe hapo tutapata pesa kidogo ya kufanya 1, 2, 3, 4. Whoever has been doing illegal businesses, let them be put to justice, because the justice system, number 2, because the institution already is corrupt. The justice system in itself is already corrupt. It's not even giving justice on time. It's not even doing the correct thing on time. What is happening? It trickles down to other institutions. That's why I keep insisting. You'll have half-baked doctors, you'll have half-baked nurses, you'll have half-baked engineers, such that even manufacturing a very simple thing like a mask, it is not to par excellence, like the way you'd want one imported. And I believe Kenyans have the brain and the capability of actually doing something. We are among one of the smartest people in Africa. We have a very good labor force. But now we need to instill the excellence, the culture of excellence, the culture of proper running of institutions. That is what we need to instill in our people, so that the culture changes from, even if I'm half-baked, I'll still get a top position. We need to shift from that, and it's very evident even in the leaders we choose. We choose half-baked leaders. We choose leaders who are not excellent. A simple thing like a road, small road, you can see there is no excellence in it until a Chinese has to come on board. And yet we have civil engineers, we have structural engineers, but they cannot build the same roads that we are proud of. But when you give a Kenyan to build the same road, they don't reach to par excellence until a Chinese come in, and then you're like, you can now notice the difference. It's
because Kenyans love the shortcut.
Exactly. So we need to instill a culture of excellence. And once we kill that root of mediocre, I would call it mediocrity, because if you're all mediocre, even the type of leaders you'll produce are going to be mediocre. So you'll have a mediocre nurse, you'll have a mediocre doctor, you'll have a mediocre teacher, you'll have a mediocre engineer. So it will be replicated all over. And this is the thing, we cannot start killing the fruits and you have not dealt with the root system. We have to go deep into the, and this is the right time. With COVID, we need to go down into the root system. Kibaki really tried in terms whereby you'll head an institution based on merit. But even if you are given on merit and you have very good papers, but how well were you grilled to have actually earned that? Some people went the back door and scored A's. Others went the back doors and were able to acquire degrees, right? And you still got that portfolio. But now when it comes to actually result-oriented, funny enough, I'm a result-oriented person. When it comes now to the result itself, it is not to the quality, to the excellence.
Actually, Beatrice, we have very smart people, but the problem is the smart people are very corrupt. They don't, no, the problem, they don't do things to the excellence that you want. They don't make the roads, they don't construct the roads that you want, that the Chinese can construct. It's because me in Dafikiria, here I'm supposed to use 15 tons of gravel. Let me use 5.
But it's because it's a culture.
Yes, that's what I'm saying. It's not the training. It's because you are well trained, but then again you are corrupt. That I'm thinking, as a doctor, I have to prescribe this medicine to you, but instead of me making the hospital procure the medicine, I will tell you, by then you can have a clinic pale. See, after this prescription, just go to my clinic.
Selfishness.
Yes, the selfishness, the greed, all that. That is why we have public institutions that are failing. Why do we have so very good private schools and very bad public schools?
All right. Actually, on the same thing she has been mentioning of the excellence, we are having a problem now. The president is being torn between or reopening the economy or letting things remain as they are. We also have the other problem of the resumption of schools with this. Children go back to school. How is the testing? The Professor Magoe says they will ensure all the teachers will be tested. And before we even began, we asked even will the kids be tested? But even so, do we see the education that we had from the physical class to online and back to now physical again? What will be happening to these children mentally in terms of education?
Are we ready for reopening? I don't think. If we look at the health status, we are not ready, but our economy is suffering. So it's either people will die from COVID or die from hunger. The president has to choose between those two.
Right.
And when you look at it, our country had not gone into a lockdown. We were still a little free to move. Just that even before COVID, we also had these problems that we have are pre-existing. Apart from schools, everything else has almost remained constant. That this COVID has made us realize the government has been living like us. That unaona vile unagojanga mshahara, unapatia rent, unalipa madeni, unafanya kitu kingine, then you're left as you are.
Unafanya kazi tena.
To go back to work. That is the same way the government has been living. That it pays wages, does that, but it didn't have extra funds for cushioning in case of a pandemic or in case of an emergency. So if right now we say that the government reopens and helps the business people get back to their feet, is it even realistic? Can our government do that? Can our government afford to cushion our business people? I don't think it can.
All right.
But for that, in terms of the education sector was already ailing. Remember, the government had said 100% transition. Kibaki came with the free primary education prior. So we already have kids who have done class 8, but not transitioning to high school was where there was a bit of a gap. So it reached a point the government introduced a policy of 100% transition, that whoever does class 8 transition, or everybody transitions to high school, so that at least the populace will have at least literate people with at least an O-level kind of a certificate. Now, the problem was one. You've gone to a school, let's say like Limuru Girls High School, for example, which I am a PTA member. The school initially was a 3-stream, right? Now you have insisted for it to have 100% transition. That means for it to have 100% transition, it has to be a 7-stream. So where does the school get 4 classes from? And already the infrastructure itself, it's either 1900 or 1920 thereabout, right? So government was not even funding these institutions to be able to set up infrastructures. Parents were the ones going back maybe to their pockets, public participation, to try and ensure a Harambe way of doing things, to ensure institutions are being set up, right? So now when you now want us to go implementing COVID measures, do we even have the infrastructures in the first place in our institutions, right?
Even the teachers strike?
Exactly. So first of all, even before we look at the teachers, let's just look at the building where these children are going to go. The dormitories hakuna, dining hall hamna, classes bado, some schools sorry, have not been able to transition fully 100%. And even if they have transitioned 100%, kids are squeezed in classrooms. You find a classroom of 60 students. A class that was initially to host 30 to 40 students, now is hosting 60 students. Now you want to bring the 1.5 meter measures. So do you see where the challenge is? Where will there be this space for the kids to actually utilize? Up to that point now, when you say now you're going to test the children themselves, how many kids do we have in this country? Already we have a challenge of even testing people, even in Nairobi only. So now all the students to be tested, is it possible? Number 2, are you even capable to test all the teachers? Now, she said, if the interval is 14 days, how often will you be repeating amongst the same children? Now, don't only focus on high school. We have the primary school and we have the kindergartens. Are you looking at all? Because that's the whole education. And then we have the university students. So one, already there's already a challenge of infrastructure. Let's agree on that. That cannot be able to put in the measures of COVID in itself.
Sure.
Hillary, I think you're going through about COVID in a very short-sighted manner. For example, when you say we test teachers, okay, that means that when children are reporting back to school, they have to go back to school with a certificate showing that they had been tested. But for how long? How viable is that certificate?
Exactly.
I can be tested today, 21 days from now, I can have COVID.
Oh, because you'll be moving actually.
Because I'll be moving around and interacting around and doing this. What COVID has brought to us is we have to change our settings. Right now, instead of us having the conversation that's about going back to school, which is not realistic according to me. It's not realistic for us to have a class that used to have 80 students. Now tell them that you have to observe social distancing of 15 students per class. How many classes does that school even have? It already had the problems of infrastructure even before COVID. The conversations that we're supposed to be having right now is supposed to be realistic and tenable. Like, these students cannot go back to school. That's the reality of it. Can we now look at how these children can continue learning under the circumstances that we have? How can we enable these children in our rural areas to go through the same? I left my son at home. He was on an online class. How can that child who is back at home in Oshago have the same advantage with this child in Nairobi who has a tablet, who has internet settings, and who has a teacher who is engaging him in a Zoom class? So now we are supposed to think about bringing these other children who don't have this advantage, bring them at the same level of advantage with the children at the private sector. I think the Minister for the CS for Education is going about this in the wrong way. Let's be realistic. Let's now start thinking about how to engage these children on online classes until we have a more permanent solution, until we can live with COVID. Maybe get the herd immunity. Then we can all go back to school. But as at now, how will we engage these students? They've been at home since March. They can be home back at December. That's how the pregnancy needs are going higher.
They're idle.
They're idle. We need to find something for them. These are young minds that we need to start engaging right now. You can't keep a child who's 5 years, who is around 10 years. You can't keep him at home from March to December.
Actually, one of the suggestion, the task force that's for education, because parents were engaged actually on how the strategy for kids to go back to school. And one of the strategies was kids not to go back to their initial schools like before. For example, you could be in Nyeri, but your kid was called to Alliance High School, so they have to travel. Or you come from Turkana, and maybe your kid has been is operating from a school in Nairobi. So now they were suggesting they look at schools within the county.
But do those counties even have those schools?
That's what we are saying. They look at the counties first. The first suggestion was to look at the counties, the schools that they have, and how many students can be contained. Because remember, right now, you cannot start putting internet in Turkana right now.
Actually, you can.
You cannot start giving laptops right now to a student, maybe even in their own homestead. Hakuna hata stima. So first you have to start installing the stima in those deep rural areas, right? Accessibility of, right now there were rains all over, right? And floodings and everything. So how are people now even going to access even such, the things that are there are actually very, 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 very critical, to the point now we have to agree or disagree, whereby if we are going to set infrastructure, and I still go back again to my point of institutions. So first, the schools, how many do you have? What is the population in that county? Based on the number of schools that we have, do we have kids boarding or doing the schooling? You know, you have to look at it so that you can say there's now going to be a schedule. If it's 15 per every lesson, can the kids be staying at home with their parents? Because also remember now the food and all these other things.
But I also think there's the consideration of the region. If I'm in this region, say this is Nairobi CBD, we have only one school which is primary, but has the population that can handle that only. Then we have another one in say Westlands. there's no school in Westlands, there's no school in Kasarani, only this in Nairobi.
Yes.
How will they now start merging, and how will they live if not boarding?
Hillary, you see, we are thinking like as if this country is very rich. When we start saying about building infrastructure and doing this and doing this, TSC teachers are actually receiving salaries since March.
Yes,
Tangu
they have.
tufunge shule, they've been receiving salaries. In health, we have community health workers who go home to home. When HIV was very prevalent, they used to go from house to house administering ARVs. Why can't we do the same with the teachers? We have teachers in every village. These teachers, what are they doing? They are receiving salaries from TSC.
They should be doing something.
Yes, why can't we just have community engagement of students? Like get a data of all the teachers in this ward. How many teachers do we have in this ward? Okay, you'll be teaching class 1 students. Go home to home. Give an assignment to these students. What are the teachers been doing from March up to now? What will the teachers be doing from March up to December? Why can't we engage the teachers to do community outreach to the students at home?
Are the teachers enough?
They are. How have they been operating?
No, you see, when you have a classroom of 80 students...
It's not a classroom situation.
I'm just saying, if it's a classroom of 80 students and there's one teacher is reaching to 80 students at once.
How do community
now, when you
health
do
workers
community
reach
health
to-
worker, you see, the population of patients is different from a population of students. You see, remember, a sick person, you could have a population of 100 people and maybe 10 are sick. The rest are healthy. So the 10 and you have community health workers, it's able to. But now when you talk about students in per se, these are not sick people. So in one class where one teacher was teaching 80 students, now you want to tell that one teacher to go to 80 people, it's not possible. So
it is actually possible. Let's do this. We have so many resources in this country that are not used. For example, what do we do with our chief's camp? Apart from having those public barazas, why can't we have a schedule at the chief's camp for this village? Tell the villagers there's a schedule at the chief's camp. Tomorrow, on Monday, the class 1 teacher will be there. She will be giving assignments to class 1 students. If you have a class 1 student in your home, please let her come to the community. Take away. Aende kwa mwalimu ampatie assignment, go back with it, bring it next Monday. At least you have these students who are being engaged weekly. It doesn't have to be online. We don't have to use internet. Let us use the resources we have right now. Because when we say about building classes of 15 students per class, surely it's not
It will
even
not be possible for now.
Classroom goes for 500,000. Classroom goes for 500,000. To government, national government rates, it might be 1 million per class. Hapa sasa ndio tutaleta wizi yote, considering we don't even have...
I would want our audience to react to the same questions, what they feel about the homeschooling, which will be now the community, the teachers now going to the homes and teaching or giving assignments. That you could send your comments to all our social media platforms at Y254 channel on Facebook and Twitter and Instagram as well. Tell us, what do you take, what do you feel, or what should be your opinion when we say teachers should be going home, door to door, teaching students other than online? Because actually the online is favoring only those that are able to have the tablets or the laptops or have the TV set for them that are watching the TVs, but someone far flung in the villages are not able to access that. And actually I'm sure most of the people or most of the students are now engaged in the shambas. They are not learning. So what's your idea? Tell us what you feel about that. Because you wanted to weigh in.
Yeah, I wanted to say that maybe the only way out, if she says the outreach thing, and I am borrowing a leaf from the healthcare sector where I have more experience in, is where we reintroduce untrained teachers. You get, we have people who maybe did in university mathematics.
Cheaper. Actually,
or
our
chemistry.
university students are at home.
Exactly, that's what I'm saying. So we, in Kenya we had an exposure of having untrained teachers. They can be given a small stipend by the government to be able to do now the outreaches and do the homeschooling settings where the kids can still be in their homes, and you can have actually, when Uhuru is saying vijana na kazi, this is the right opportunity. This is the right opportunity for actually Uhuru engaging. We have very bright university students who have been jobless for a very long time. They can use their intellect. Being a medic myself, it's very easy to go teach biology to these students as an untrained teacher and engage these students.
And you see, it's much cheaper
It's
than
cheaper.
us building a class of 1 million.
For now, because it is not sustainable. For now, yes.
Now we can do
for
that.
now, we can do it. Actually, it's a very good suggestion. I hope Uhuru is watching us.
You should have been in the committee to come up with these ideas.
Uhuru is watching us to, actually, this is the way to go, and I hope even Magoha is watching us. Actually, we can engage untrained teachers. They are not really employed by TSC, but they can be quote unquote be like community health, community education
And you see, TSC teachers have been earning a salary for what?
Then maybe a TSC teacher can coordinate the untrained teachers.
Yeah.
Then they are dispersed to the community. And they can, one untrained teacher can be told, this homestead, it's you who is going to ensure that the students are engaged.
At least make sure that the students are engaged at least 3 times a week. You're not asking for so much.
Yeah.
Instead of them being free from March to December, then taking them back to school again in January.
And actually,
we shall not have students to take back to school. Children in their teenage will all be pregnant. And we shall be here talking about children being raped, but most of them were not raped. It's because they had nothing to do. And then we shall be here. But then let me tell you, the results of COVID shall be felt 20 years from now. When these students who are in class 1 are now grown-ups who have responsibilities. This is a child who was kept free for 1 year, a whole year, at around the age of 13 years, 10 years. Tell me what is happening to that child's mind. It's a mind that has become idle. There's nothing going in. At a crossword, at a gazeti hasomi. You know, children nowadays don't even read books. They don't even read storybooks. So what is going into this child's mind? This is the best time, the earliest time for you to mold that child's mind. Hata kama wanafunzwa kitu moja peke yake. Hata kama wanafunzwa cleanliness or hygiene. But these children need to be engaged in something until December.
Actually, to tap in what she's saying, because COVID is so health related. If they introduce the untrained teachers, they can now combine with a community health worker, just to ensure that even in those homestead and in villages, the untrained teacher accompanied by a community health worker are ensuring COVID measures are being taken into place. People are observing hygiene. In a way, it can actually help flatten. Yeah, it can actually help flatten the curve in its essence, because apart from community health worker teaching these villagers, or I would say citizens, on how to carry out hygiene practices, then it can also promote other things that we know this COVID, you fight it with your immunity. I was seeing the Ministry of Health website pages. They were telling people how to eat properly. This is the right time to engage now the community health workers, the public health people, to engage I usually say every sector is intersectoral. You cannot be so independent. Education sector cannot be independent on its own. The healthcare sector cannot be independent on its own. True. So when we are, and this is what I preach always, let's have departments that are intersectoral. Let's not have an independent kind of governorship where each department is always independent on its own. This is a very good example. You bring in the community health worker, you bring in the untrained teachers. They're able to go into the communities. And the chief, the way they were being told by Uhuru, the people were teenagers to not be getting pregnant under their watch. This is
but
the right
how do you
time.
ensure those teenagers don't get pregnant?
No, I'm saying this is the right time, because when you have an untrained teacher, you have a community health worker engaging these students, telling them the dangers of unprotected sex. You see, they're also teaching them about HIV/AIDS and STIs while they're engaging these students. This is the right time actually to implement what is it called, community participation, and also it's part of actually community development. So your PESA World Bank has been given to the government. I think this is the high time Uhuru should engage the youths, because there's so many youths who are very much unemployed and would actually benefit in flattening the curve, and also ensuring now our young people are actually engaged in terms of education.
You see, Hillary, also.
All right, that would be the last comment. Then from this we will take a very short break, and after the break we'll be talking about the politics. That comment.
We have a lot of resources in this country that are never utilized. For example, we also have agricultural field officers. What do they do? These are people now that we can bring together right now and start teaching children. We don't have to teach these children algebra. long division, sijui multiplication.
Na
Let us
hazitumiki
teach
kwa maisha.
as it time ya COVID. No, COVID has taken us to factory settings. This is the time now to engage children in life skills. Wacha kama walimu hawatoshi, we engage even the agricultural field office in that place. Aseme watoto wa between 10 years na 16 years, today we are teaching them how to plant sukuma wiki. Wacha watoto watoke nyumbani na skills during this COVID time. But we can start saying CBC mtani, but then we can start a CBC mtani. Tusianze kusema that sasa we need the children. What do they learn in school that they cannot learn at home when they are at home? You know, every place, everywhere you are is a classroom. I say every day you learn something new.
True.
So we can have a classroom anywhere, everywhere. It doesn't have to have desks and books. They don't even have to use textbooks, if that's the problem. Let them come and community health officer or fundisha. They might come across a COVID patient. Let them know what to look out for. We don't have to have these TV advertisements every time on what to look out for. Like imagine if a 5-year-old knows what to look out for COVID. Yes. It helps us flatten. Tutakuwa na nurses kila mahali. If this 5-year-old knows that if you have a breathing problem, what you're supposed to do to this person who has a breathing problem.
Whether they still taught the emergency responses.
Yes, the emergency response, the first aid, agriculture, teach them everything. It doesn't have to be what was in the curriculum.
So the agriculture extension officer, the community
health workers, let us do this. Our watoto wakwe wa community that now in the villages hatuna internet, hatuna data, hatuna easy. But we have these people in the villages. We don't have them in Nairobi. Do you have agricultural officers in Nairobi County? I don't know. I've never heard of them. By the way, wako wengi sana na wanaweza ingia huko mashinani wafundishe watoto Kibra kupanda sukuma kwa gunia.
Yeah.
That's a good point. We will be taking a very short break, and when we come back, we look at the politics. That was the response to COVID-19, how things are in terms of education, whether they will be resuming schools, what needs to be done, what is possible to be done right now, or what is not possible. Send us your comments on what you feel about the home teaching, the untrained teachers going around teaching our students back in school. We are saying CBC mtaani. We take a very short break. Do not go too far.
Every Tuesday at 7:30 p.m, the Buzz Y254 gives you a 360 view of what's happening in the entertainment scene.